Good morning and welcome to the Louisiana Restaurant Association's webinar, A Tool to Retain and Attract Employees. I'm Wendy Warren, Vice President of Communications, and I'm also joined by LRA Vice President of Member Services, Pam St. Pierre, and members from our team. For the past decade, LRA President and CEO Stan Harris has worked on an offering of this kind for LRA members. And in the past 5 years, with our partners at Pan American Benefit Solutions and Hub International, we've crafted this offering to aid in your retention and attraction strategies for employees. And that's never been more important to our industry than we're finding right now. We are pleased to offer the Hospitality Healthcare Plan. Your lead presenter this morning is Lynn Schramm. She's the Regional Vice President for Pan American Benefit Solutions, who will provide us with an overview of the program. She's also joined by members of the Pan Am team. So welcome to all of you. In addition, we'll hear from Maria Taravella, Voluntary Benefit Practice Leader for Hub International, and members of the Hub team are on the call as well. So welcome to you guys. Lastly, we'll hear from Keith Kennington with Healthcare to You, which is a piece of the puzzle here we have this morning. And we'll answer your questions at the end. So as a reminder, please mute your lines. And during the presentation, if you have a question, please enter it in the chat box and we'll get to those at the end. This presentation is being recorded and will be distributed later today in the LRA e-newsletter, The Snapshot. So now I will turn it over to Lynn Schramm.
Thank you so much, Wendy, and good morning, everybody. So happy to be here with you. One of the things is Wendy touched on, literally for over 5 years now, we've been working with Stan Harris to develop a easy access, affordable healthcare plan for the LRA members and your employees. So we're very excited to be introducing the Hospitality Healthcare Plan to you. We know that one of your greatest challenges right now is staffing. So today we're going to give you a good high-level overview of the Hospitality Healthcare Plan, explain how this can help you attract and retain employees, why this is a good benefit for your workers, and how your employees can enroll in the plan. As Wendy mentioned, these are the providers behind the scenes. I'm with Pan American Benefit Solutions, which is actually a member of Pan American Life Insurance Group. We're based in New Orleans, and we are an A-rated insurance carrier. We also have partnered with Hub International. They're one of the top insurance brokers in the United States. And Healthcare to You, which is the nation's largest and fastest growing direct primary care provider nationwide. So let's talk a little bit about turnover. And you guys know this best because you work in this industry, the hospitality industry. And employee retention is just a big issue in the workforce right now. It's just about, keeping your employees happy. It's about retaining your talent and ensuring you keep the best people with you as long as possible. Right now, about a third of new employees quit after about 6 months, according to statistics. And, replacing an hourly worker can be as high as $6,000. In 2019, the annual employee turnover rate in the service sector, hospitality, is hovering right around 79%. And replacing an entry-level position can cost you up to 50% of an employee's salary. So one of the ways to attract and retain your top employees is through benefits. And many businesses, particularly smaller businesses, are just not able to afford quality healthcare insurance for their employees. And HHP, this is a good fit, particularly for smaller employers. But even larger employers, businesses are opting for higher deductible type policies and more employee cost share as a way to deal with the rising cost of premiums. And even if an employer offers health insurance, many hourly workers do not enroll because the premiums are either too high or that particular plan has a very high deductible that they have to meet. And so you as an employer can actually retain and attract employees using LRA's new benefit options, which is the hospitality healthcare plan. Unlike most health insurance plans, as I mentioned, they have high deductibles, and these can be as high as $8,000. Our particular plan that we've developed, the hospitality healthcare plan, or we refer to this as HHP, there's no deductible that has to be met. And the acceptance is guaranteed during open enrollment. Your workers can choose from 3 plan options, health plan options. They can purchase individual coverage, or they can add their spouse and kids and cover them as well. And we have an optional dental and vision plan that they can enroll in. It's very easy for your workers to see a doctor or a specialist, something that people without health insurance often avoid right now. And so when we designed HHP, we really kept in mind, we wanted to keep it very simple for them to access healthcare and to see a doctor, because that's one of the #1 benefits that people are going to be using. We have many other benefits that are included, but doctor visits is the #1 benefit of all health plans that people use. So this plan is going to give them easy access. We also have some fixed indemnity type benefits built in for many medical services, such as like hospitalization, ICU stays, and surgery, and much more. So what are the advantages for you as an LRA member? Well, right now, if you want to offer health insurance, you can put in a group policy yourself, right? And as I mentioned, a lot of employers, particularly smaller ones, cannot afford to put a group policy in place. The advantages of using this plan to you is HHP is actually through the association. So you're actually not the policy holder, okay? So this is a great hiring and retention tool. There's no employer contribution required on your part. And the premiums are actually paid by the employee. And we give them a couple of options through an automatic withdrawal from their checking account, or they can use a credit card. Best of all for you is there's no minimum participation requirements on the plan. So even if you had 1 employee enrolled, that's fine. You can offer this to your full-time or part-time employees, and there's no wait period for your employees that they need to meet before they can enroll in this plan. Best of all, there's really no administration that you're going to have to be responsible for. There's no paperwork. All we need you to do is refer your employees to HUB's Enrollment Call Center, and I'll give you some information about that here in a minute. And HUB's professional benefit counselors will handle the rest from there. Now, what are the advantages for your workers? Well, as I mentioned, the plan's guarantee issued during open enrollment, so we're not going to ask any medical questions. There's no exclusions for pre-existing conditions. We offer affordable plan options so that they have a choice in the levels of coverage that they want. As I mentioned, the plans do not have any deductibles that they have to meet. We start paying day 1 towards those benefits, so they're not responsible for meeting the deductible. Your employees can talk one-on-one with HUB's trained bilingual counselors who will make sure that they understand their options to help them make informed choices. And then your employees can choose either a monthly debit from their checking account or a credit card payment, whichever premium payment works the best for them. HHP provides very valuable healthcare benefits. As I mentioned, we have 3 simple ways for them to see a doctor. The first is we provide unlimited virtual direct primary care visits through Healthcare to You. They're one of our partners. This will allow them to talk to licensed medical professionals either online or by phone, 24 hours a day, 7 days a week, every day of the year, who can do diagnostic consultations with them for minor illnesses and injuries. And best of all, there's no cost to use this service for that insured member. The second is if the member would like to see a direct primary care provider in person, when they call that number on their ID card, they'll give them a choice of a virtual visit, but they also will give them a choice to schedule an appointment. If they see a doctor in person, the insured member will be responsible for a $10 visit fee. If they go to one of our direct primary care urgent care centers, they will be responsible for a $25 fee. And under that same $10 visit fee, these providers also are going to be able to help treat and manage 13 of the top chronic disease states. This includes things like asthma, diabetes, high blood pressure, gout, for example. So if somebody doesn't have health insurance and they have one of these 13 chronic disease states, now they can actually establish a relationship with a direct primary care physician in order to help them get that condition under control. As part of that also, there is an annual physical that the member will receive with 4 of the top lab tests. That includes a complete metabolic panel, complete blood count, thyroid stimulating hormone, and a lipid panel. And then the third way to seek a doctor is we have our PanaMed indemnity benefits built in to all 3 of the plans, which also includes a national PPO network, which the national PPO network is First Health, and there are over 600,000 providers nationwide that they'll have access to. As part of the PanaMed indemnity plan, this is a limited benefit plan that pays a fixed benefit amount to help cover things, common medical services like going to doctors, specialist type visits, x-rays, major imaging, hospitalization, surgery, prescriptions, and much more. The plan's not designed to cover costs for serious or chronic illnesses, so it's not a major medical coverage. However, it is a fully insured option, the PanaMed plan, and it will pay specific dollar amounts towards those medical services that are listed in the summary of benefits. The HHP health benefit plans also include, as I mentioned, prescription benefits. We have off-the-job accident benefits with accidental death and dismemberment, the national PPO network, which is First Health, global repatriation. This benefit's great if you've got any of your employees that are traveling more than 100 miles of their primary residence. And hopefully this won't happen, but in the event that they pass away while traveling, what the global repatriation benefit will do is it will help repatriate those remains back to their primary residence. So even if they're traveling in the United States, or let's say abroad, internationally, or if you've got employees that may be working at your restaurant, your place of business, that may be from another country, and in the event of their death, this particular benefit will help repatriate those remains back to their primary residence. And then we also have advocacy services to help that member negotiate any claims that may be in excess of the benefit amounts listed in the plan. And then finally, we have dental and vision. Again, this is an optional benefit that they can enroll in. Pan American has partnered with Healthcare to You to create a national direct primary care focused plan specifically for hourly and junior management employees. And employers can now offer quality, convenient access to healthcare at a minimal cost. The PanaMed plan, as I mentioned, combined with Healthcare to Use direct primary care, provides an extensive network of physicians nationwide. At this time, I'd like to introduce Keith Kennington. He's with Healthcare to You. So he could talk a little bit more about Healthcare to You and what they have to offer.
Well, thank you, Lynn, and thank you all for attending today. Healthcare to You, the best way to think about us is to think about us as though it was your doctor's office. Because the best part of what we do, yes, a $10 visit fee to see a physician in person is wonderful. Yes, if we need to send you to urgent care, a $25 visit fee is wonderful, or a $0 visit fee if it's virtual care. All of those are great things. But the best part of what we do is we really treat our members as though we are a medical concierge service to them. In fact, we like to say that we are medical concierge for the 90%. So when a member is ready to seek care for whatever reason, they simply call our 1-800 scheduling line. That line is manned by medical assistants, just like the medical assistant that sits out in your doctor's office. They triage you, they take your intake information for our physicians. They actually call and make the appointment for the member, call the member back and let them know, okay, we've scheduled you an appointment to see Dr. Billingsley. You can see her this afternoon at 3 o'clock. Just bring your $10 and you'll be seen. Now, that's really the best part of what we do, because our members don't have to thumb through a PPO directory. They don't have to look for a doctor near them. We do all of that for them. So it's just really a wonderful experience for our members. Now, here's something that's really important to understand, and that is, if choosing your own doctor is important to you, you can ask us, is this doctor in your network? And when the member calls in, if they're not, they can still see a doctor through the Panamed portion of the plan. It just wouldn't be through the direct primary care portion, and a benefit would still be payable. But they would then go to their First Health PPO directory and look for a physician that would be paid not through the direct primary care. For most people, most of the time, our top graded physicians are a perfect match for them. Many times, what we are discovering is most people anymore do not have a true direct primary care relationship. And so choosing their own doctor is not something that's necessarily important to them. They just need to see a physician, and they need to see a high quality physician. So it's really easy to access care through us. A single call to a 1-800 number. Our medical assistants take care of the member either with a virtual care scheduling or an in-person care. If urgent care is needed, we'll send you to our closest urgent care facility as well. We guarantee access, so there's never a problem accessing a physician near your work or near the member's home. So we like to say the best care begins with a call to Healthcare to You's 800 number. We'll get you to the right place at the right time.
Thank you, Keith, so much. So let's talk about the monthly rates. We have, as I mentioned, we've got 3 different health plans that include direct primary care, the Panamed benefits and direct primary care. The low plan, plan 1, is $94.43 a month. This will cost your employee as little as $3.10 a day if they enroll in individual coverage on the base plan. They can also sign up their entire family. It's $252.53 a month, which comes out to $8.30 a day to cover their entire family on that base plan. Now, if they want more extensive benefits, we have 2 buy-up options. All 3 of these plans include direct primary care, but the Panamed benefits, the amount that we pay towards hospitalizations, surgeries, anesthesiologists, emergency room visits, those sort of things, it's definitely going to cover much more on plans 2 and 3. So the premiums are going to be a little bit higher, but Hub is going to give that employee, when they enroll, different choices in care, and they get to decide which plan is best for them. They can also enroll in dental and vision. And we have a great dental plan and vision plan for them for $27 a month. They can choose dental and vision by itself. They can choose the health plan by itself, or they can choose both of those together. And now I'd like to turn this over to Maria Taravella. She's with Hub International, who's going to highlight some of the benefits of using Hub. Maria?
Yeah, there we go. I'm on. Okay, thank you. So there are a couple of things. I'm going to go over how our enrollment team will be helping each of your employees. But first, I want to go over a few things about what employees love about this process. We are not actually using a scheduler for this enrollment, but the one-on-one setting that the employees will experience is beyond anything that they would get through just written documentation or a group setting. They will feel comfortable enough to ask personal questions that pertain directly to themselves or their families. Our knowledgeable benefits counselors will walk them through their options. As we mentioned earlier, we do have bilingual counselors if necessary, and they can also help the employees in their own language for a better understanding of the benefits that are available to them. What companies love about it is, as Lynn mentioned, there's no direct cost for our call center services at all. It's 100% free, and we're there to help your employees. Our counselors are well-trained enrollment counselors who will understand the HHP benefits. They're very comfortable explaining it to the employees and answering any questions they may have. Lynn, I think we have a second. Do I have access to move the slides, or is that you? There we go.
Yep.
There we go. Okay, so this tells us a little bit about Hub, what we do. In order to enroll, for your employees to enroll, the call center will be open from 9 a.m. to 6 p.m. The enrollment starts next week, March 14th, and runs through March 25th. If you click on the, maybe I jumped the gun too much. Lynn, can you bring me back to the other one, to the other slide?
Yeah, I will.
Nope, not there either. I'm sorry. Maybe I'm looking for another slide. The link where they can enroll. I was going to walk them through that process. Do we have that one?
Yeah,
I know there's a slide in there with the enrollment link. Okay. So
yeah.
There's an enrollment link that Lynn will be showing you shortly. And when you click on that link, I just wanted to make sure you guys understood how easy the process is. When you click on that link, there will be an enrollment guide that will be able, your employees will be able to have, that will give the 1-800 number. It will give the date, Monday through Friday, March 14th through March 25th, from 9 a.m. to 6 p.m. All they have to do is call that number. A counselor will be available to help them enroll. At the time of their enrollment, they'll be able to give their payment elections if they choose to, or they can receive a link following the enrollment to put their payment options in, either their credit card information or their bank account information. So just wanted to walk you through the process. Super, super simple for them. We're here to help. Any questions they have, if they enroll and then they have a question following the enrollment, they can feel free to call in and ask the counselor again. If they have a spouse who wants to be on the call and ask questions at the same time, we encourage that as well. So any questions they have, we want to make this as seamless as possible for them and for you. We're there to help. And this again is a little bit about Hub. Hub is an international broker. We're one of the largest in the country. We have over 13,000 employees. We have over 1 million clients across the globe. We are very, very knowledgeable in all benefits, P&C, accident and health, and we're very happy to be part of this partnership with Pan American Healthcare to You, as well as the LRA. And here is the slide I was looking for, sorry. And again, the coverage begins April 1st. The open enrollment starts on the 14th and runs through the 25th. And if your employees do not take advantage of it during this period, they will have to wait until the fall enrollment. And those dates have not been decided upon, but it will be sometime in the fall. So hopefully they take advantage of it this time around. And if not, we'll be ready for them next year. In the fall as well.
Lynn, we have a question in the chat.
Okay.
The question is, would still be required to offer a sponsored affordable plan under the ACA guidelines if we offer HHP, or does it replace the ACA plan that we already offer?
That's a great question. No, this plan is, the HHP does not provide minimum essential coverage, or it's not a minimum value plan. So if you're currently offering a group health insurance plan today, this is not replacing that. This is a supplement, a base plan that you can offer alongside any type of plan. That's really your option. You would not be the plan sponsor of this particular plan. But what I usually tell people, if you've got a lot of employees who are waiving coverage right now, particularly your hourly employees, they're probably waiving it in most cases because either the premium cost share is too expensive for them, or the deductible is too high. And so, although this is not a major medical plan that provides catastrophic type coverage, this is going to cover most of the common things that they use on a regular basis. So you could, for those particularly who may be waiving your plan, you can offer this as a optional, type benefit for them. But I would definitely not replace, your current health plan with this.
And then the next question is, can they enroll if they already have insurance through work or Medicaid?
So if you currently have coverage, let's say through your spouse, or you have someone who's on their parents' plan right now, they're under the age of 26, they can enroll in this plan. The plan is going to pay regardless if they have other healthcare benefits or not. In that case, if they have other health insurance, this particular plan can help cover many of their out-of-pocket expenses that they may have on the other plan, like deductibles and copays and things like that. Now, if somebody is enrolled in Medicare or Medicaid, their Medicare and Medicaid is going to treat this as primary coverage. So it's something that they need to keep that in mind, and they'll have to make an informed decision if this is the right plan for them.
And then another question we have is what about prescription coverage? How is that addressed in this?
Yeah, so we do have prescription benefits built in. When you go to the enrollment page, in fact, I'm going to bring this up because some of these questions may come up here. This is actually the enrollment page. If you click that link that you're going to go to, and at the bottom of it, it does have an enrollment plan overview. You can get this in English or Spanish. And I'll show you what this looks like. This has on the first page all the open enrollment dates, who to call. You literally just have to download this and give this to your employees. But it has Hub's call center number that's available. And then it has the rates, the 3 easy ways to see a doctor. It's got information about healthcare to you that Keith went over. These are the 3 different plans, the medical plans that are built as part of PanaMed. and all the different benefits. And the amounts that you see here is what we pay towards that medical claim. Second page goes over, first page has like hospitalization, specialist type visits. The second page, your inpatient and outpatient type surgeries. And then as you asked about prescription benefits. We do have all three of the medical plans include prescription benefits. The base plan has a discount prescription card built in, so they're going to get discounts anywhere from 10 to 79% directly from the pharmacy when they fill a drug. The plans 2 and 3, those two buy-up plans, have what's referred to as our indemnity RX benefit. And so it's going to pay a fixed dollar amount towards a generic. And if they're on plan 3, they actually have a fixed benefit amount towards a brand type drug. And that's paid on a daily basis, that benefit amount. And so let's say, for example, you fill a $4 generic drug at the pharmacy and you're enrolled on plan 2, you'll get a $10 generic drug benefit. So it's going to cover that $4 generic fill. But because we have to pay out that full benefit amount of $10, whatever that indemnity benefit is, the cost of the drug was less than that. So we're actually going to mail a check for the difference of $6. If the generic was more expensive than $10, let's say a $15 generic fill, the member would be responsible for the difference of $5. We would pay $10 towards that, and then they would be responsible for the remaining cost.
Okay, Lynn, we have another question.
Okay.
If our open enrollment is November 15th to December 15th, and the open enrollment for this plan is not in line with that, would employees need to drop their coverage next fall and be covered until they can enroll in your plan? How do the open enrollment periods line up?
So just as like the marketplace, for example, the plan that we're offering through the Louisiana Restaurant Association, we have 2 open enrollment periods per year. One in the spring, which starts March 14th, next Monday, and then we'll have a fall open enrollment, which is scheduled in October. For your group health plan that you may be offering at your place of business, you obviously may have different open enrollment periods that are different than this. So your employees, if let's say that they're waiving coverage right now, they don't have any health insurance, they can sign up for the spring open enrollment starting next Monday. That runs through March 25th. Coverage begins April 1st. And if they can keep that plan, but if they decide that they want to jump onto your employer health coverage plan during your open enrollment, they can drop this plan and enroll in that. And vice versa, if they're enrolled in your plan and they decide that, they want to drop us and enroll in this, they would definitely have to wait till open enrollment to be able to enroll in the plan. So this particular plan, it's offered through the association. It's just another option for them. It's just like, even if they went and got individual coverage somewhere else. But we only hold open enrollment twice a year.
Okay, and we have another question, Lynn. How does the network compare to Blue Cross Louisiana? Are the doctors easily accessible in the area?
So I can't speak on behalf of Blue Cross's network. I think it's a fantastic network, but as far as if the doctors are in Blue Cross or if they're in this network, that I cannot answer. I will tell you, as Keith mentioned, if they're using direct primary care as part of healthcare to you, they've got A-rated doctors and so forth that they can call the central scheduling department of healthcare to you to make that appointment. If they're using the Panamed benefits for most of their other services, that's through the First Health Network. And right here on the screen at the very top of the page, we do have a provider link here. They can just either call this phone number or they can do a search for providers. So if they're if they have a provider they've been seeing already and they want to see if they're in the First Health Network, they can just call this number or go to this link. They can type in the provider's name, or they can also type in their zip code and do a mile radius. So for example, if they want to look up hospitals or pediatricians, for example, in their zip code, they can look those up as well.
So our next question, I think that may be answered in this link you just discussed. Is there a way our employees can look to see if their direct care doctor or specialist doctor is in your network?
Yeah, the same thing. They'll want to
Same
go
thing,
to this providerlocator.com.
Yeah. Any other questions? I think we're caught up in the chat. So Lynn, if you want to wrap us up.
Yes, I will definitely do that. So let me, so this is my contact information, and I see several of you on the call today. I've already talked to you. We have received just a great response from the LRA members, and we're very excited to be offering this to you. But if you've got further questions, feel free to give me a call, or you can shoot me an email. If you go to any of the web links that LRA has on their website, or the emails that you've received, it does those. If you fill that out, it actually comes to me, and I'll reach out to you for additional information. As far as your employees, again, the only thing you really need to do is download the enrollment flyer. Give that to your employees, make sure that they have that enrollment information on the first page, and just refer them over there between March 14th and the 25th, and HUB will take it from there. Donna's on the call here. She runs that call center. I will tell you, she's got some fantastic trained benefit counselors over there that are happy to answer their questions and go into the benefits in more detail and help them choose the best plan for them. And with that, I thank you, Wendy, and thank you everybody for joining us this morning.
This recording will be available later today in the e-newsletter, the snapshot, and we'll also place it on our homepage at lra.org. And if you have any following questions, you can email Lynn directly, or you can email communications@lra.org. Thank you for joining us this morning. And remember, open enrollment starts Monday, March the 14th and runs through March the 25th. And if your employees don't sign up during that period, the fall open enrollment will be in October. So with that, I hope you have a great day, and please share this information with your employees. And we hope that this will help you attract and retain your employees during this time. Thank you so much.